Okay, we're ready to start the meeting back up. We're going to do another roll call just to make sure we have everyone present.
Battery. Do you have another cord?
Here, you can take mine here.
Here we go. Boltman.
Present.
Here.
Actually, Connor's all right behind you.
We're trying to do a roll call.
Joel, I hear you.
Bernard. Here. David Engelbert. Okay, now they're off back there.
Here.
Roy Engelbert.
Here.
David Inigo. Ken Fisher.
Here.
Joe Gullickson.
Here.
Alexis Peter. Here. Susan Cohen.
Here.
David Neal.
Here.
Megan Lundo. Here. Norton. Here. Nancy Walker. Nancy, are you here? Here. Aaron Tauger.
Here.
Todd Bays.
Here.
Richard Burley. Laura Lees Wanacek. Dale Vogel.
Here.
And David Inigo.
Here.
We're back up and running.
Okay. So as we move ahead with the agenda, we're going to change the agenda, but the first thing we need to do is have a motion to accept the agenda.
I'll make that motion, Mr. Chairman.
And I go seconds it.
All in favor?
Aye.
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 So what I'm going to suggest is we're not going to do the orientation today.
Chairman Lino.
Hope everyone knows to speak on the agenda.
Go ahead.
I wanted to make a motion to amend to show that there was a changes from the original and the packet was revised. Can I make that motion?
What are you referring to?
I would like to make a motion to amend the agenda from a revised on resolution 17/2020-39. There was a change to that resolution.
Okay, we're not there yet. We're going to do the resolutions. Let me explain what we're going to do with the agenda for the rest of the meeting. Okay?
But so in the past, usually agendas reflect if there's changes to the packet.
No.
We reposted.
We reposted it.
But we didn't reflect the change.
But it was not a revised agenda.
What is she talking about?
Laura, I don't understand what you're referring to.
So in the past, if we change the packet, we usually have a revised agenda. And then there's on the agenda or the page 1, it'll say in red, you know, what item was changed or revised.
Okay, Jill is shaking her head no.
We did not amend the agenda.
We didn't amend the agenda. We may have amended something within a resolution of the agenda, but we didn't amend the agenda. So once we get to that resolution, we can make amendments.
But the packet to the public was changed. So in the past, my question, I guess, okay, let's ask this question. In the past, when our packet has changed from when it was publicly posted, we don't offer that information as revision to the public or to the county board?
Only if the agenda is amended.
Only if the agenda is amended, and the agenda was not amended. Resolutions within the agenda were amended.
Okay, I withdraw that motion.
Okay, so let me explain what we're going to do with our approved agenda. We will not be doing the orientation today. And I'm also proposing that we not do the rules of order. That's going to take a fairly lengthy discussion. And what I want to do is just take 2 or 3 things that we'd like to change within the rules of order for purposes of committee assignments today. And then in our May meeting, we will go through the rules of order in detail and make any other changes or accepting any changes that we would like at that period of time. So what I'm proposing is, with concerns to the administrative committee, currently it requires that 2 members of admin committee be on the negotiating committee. And we would like to add language to that simply says, or admin committee designees. So that somebody from the admin committee doesn't have to be on the negotiating committee. That would free up some flexibility. The second thing I'd like to do is on the sustainability committee that we're proposing and approving is to approve the sustainability committee and take it from 5 members to 7 members, which would go along with many of our other committee members. And the third thing is on the sister city committee. Currently, that is an unpaid committee position. I'd like to move that to a paid position. So people who members that are on that committee would get paid for their committee participation. I'm not talking about travel when they go overseas and not that sort of thing. That would still be out of the pocket. But I am referring to when they meet here quarterly at the county building, that be now a paid committee position, which has not been in the past. And those are the 3 items that I am proposing that we do today as far as our rules and standing committee orders. And I'll make that a motion.
I'll
Robillard,
second.
second.
All right, thank you. Any questions or discussion on that? Okay, since it will involve money, or no, it really won't. It doesn't involve any funds at the moment. We can do this on a voice vote. So on a voice vote, all in favor? Aye.
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 Opposed? Motion carried. Thank you. Now we will move down to the minutes of the regular meeting of March 31st, 2020.
Mr. Chairman, I ask that you could give the page number that's on, please.
Wait a minute. Five? 27. So does anybody have any comments, changes, any remarks to be added to or subtracted from the minutes?
Yes, I have a comment. Supervisor Lee Swadecheck
Go ahead.
on page 31. Hold on, I have to get there myself, so. If you vote halfway down the page of the minutes, where it says Supervisor Cohold questioned if the vote was tallied correctly on ordinance 2020-2. I thought it was, her question was on the motion by Inigo to postpone the ordinance 2020-2 and resolution 2020-24. It was the vote on that motion that she had questioned, I do believe. Because there, so I would make a motion to amend the minutes to reflect that Supervisor Cole questioned if the vote was.
Okay, so you don't have to make an amendment at this point. So what you want to do is you want to change that verbiage in the minutes to reflect that.
Yeah, and if you look at paragraph, the first start of the paragraph where at the beginning of the page, it says motion by Inigo to postpone. If I'm not mistaken, that's how I recall that meeting going. It was with the postponing of those ordinance and that resolution is what she had questioned the vote on.
I agree.
Okay, that's fine. Any other changes? Okay, all in favor of the approving the minutes as amended? Aye.
Aye.
Opposed? Thank you. Next, we will move down to the resolutions. Resolution 2020-36, 2019 carry forwards from the general fund accounts. Mention anything? Page 34.
Thank you.
Okay, on page 34 and 35 of your packet. So 34 is the resolution, the actual attachment to the resolutions on page 35. So from a procedural standpoint, if there are projects that were either in progress or delayed, but we're still budgeted, we actually consider what we do is we put out a request for carryover requests. Again, usually we're very strict in terms of what we consider for carryover. But you'll see there was a number of projects that were either in progress or actually got postponed due to other items. So you'll see areas and some of those are our funds. So even on our funds, we carry over. So let me do a quick summary. Under general administration, those are both our unemployment compensation account and our contingency expense. So this carried over our contingency account. For technology services, those are for projects that were not completed but are still intended to be done. Last item as far as technology services is what they call the Sturgeon Bay CAN. That's our maintenance fund. And again, that's a fund we carry over just in terms of maintenance. For soil and water, that's our water testing program. Again, those funds that we set aside special for our water testing. And we wanted to keep that water testing program moving forward. So that's being requested to be carried over. For the airport, that is the funds that we carry over each year for our long-term match in terms of what we need to do for the future improvements to the runways. And then in the finance department, those are our audits or auditing and our investment advisor. Those are funds that we use for those consulting services that we brought on. But again, right now, those are also still, I guess, what I would consider in progress and to be requested to be carried over. That's what the intent of the resolution is for.
Any questions on that? Okay, so we're going to try and go to the Vox vote. Since this involves money, we need to have a recorded vote.
Yeah, we don't have a motion.
Oh, I'm sorry, we need a motion first.
Mr. Chairman, I'm gonna go here. I'll make a motion to approve it.
Thank you.
David Albert, second.
All right, thank you. So everybody needs to open up your Vox vote if you don't have it open. Oops.
So on your screens, what you should see is just say leave event and go back in. Please, if you can, when you go, make sure your name is still there.
Okay, where does this go?
I can't leave the event.
Oh,
Just waiting for a question.
somebody might be waiting for questions, so we can do it that way.
I got all kinds of questions.
I can't. You won't let me leave it.
Get refreshed, David.
Oh.
If you can.
And then go back to that.
Go back up under Door County and click on it and it'll go back in if you didn't already. It'll work good that way.
There we go. Okay.
Made it live.
Oh, okay.
Thank you.
Thank you.
Thank you.
Everyone in? We'll try to publish the question right now.
Okay, ready?
Mr. Chairman, while they're doing that, could I ask Madam Clerk why that's up there instead of how the votes are done? Or will we not see the votes?
We won't
see the votes.
Just because we're having issues with that.
We aren't voting on a normal, like we normally do in the system.
Okay,
This is outside of the system.
but eventually, when this gets set up the way we want it to be, we will see the votes up on the board. Okay, thank you.
Not a bunch of. Oh, we'll be here. Again, we have 12 votes. Make sure you go in and hit vote on your item. We're at 16. Please check your machine to make sure you did your vote.
What do you guys think? Are you guys going to do it yet?
I got out and voted.
I can't believe it.
I hit the refresh.
I can't believe the event where we said it's going to have to
Try to refresh button.
or back.
Like up in the corner, back in the corner. Refresh. That's what I did.
Okay, really is. Somebody in that room.
There's been one question. If you can't see the question or can't refresh, just leave the meeting and then just go right back in. The code is there and your name is there. You should be able to enter the meeting right there.
Thank you.
You got it. 20 yes. 20 yes.
Okay, so it has passed on a vote of 20 yes. Next resolution, 2020-37, the DCSO cold storage facility project.
Is
Mr. Chairman, I'll make a motion to adopt resolution 2020-37.
Thank you. Thank you.
so what you have before you, this is one of our check-in points with our projects. So we had budgeted a project called this cold storage facility, which is out at the sheriff's. And again, it's not a cold storage in terms of refrigeration. This just means that it's not heated. What we store there is our evidence for the sheriff's department. We went through the process of establishing the budget for the project, and then we did the first phase, which was the scope of work. Some of the additional stuff came in high, but then we brought in a different architect and drawings. We got that, all the drawings done. That came to the county board and that was approved to go out for bid. So now the bid did go out and now we received those bids. And what you have before you is the resolution that would authorize to move forward with the construction of the project. The low bid was with Keller Inc. And that's who, under that, I guess grant would be the best way to say that, that was accepted under the emergency rule by David and I. And that's why it's bringing forward as a resolution that it would move forward as the resolution states with Keller being awarded the project and allowed to proceed. If you look at the summary of the bids is provided, this is a reference on page 41. And then likewise on page 42, when it has included the entire budget that we've done, both in terms of the top of page 42, it shows you the sources of funds. In other words, the funds we have set aside, which is at $350,000. Shows you what we spent in 2019 in terms of our expenses, in terms of design. And then what we have is then on the bottom remaining, it shows you the estimates as far as the construction now based off the bids. You can see that, along with a 7% contingency. And it shows you what the projected balance is. So as of right now, we'd be under budget overall for this project. And I guess as staff, we're recommending that we proceed as was stated in the motion for the resolution.
Any questions or discussion? Okay, we'll go to the Vox vote.
You got it?
No.
This touch screen isn't.
It doesn't work. It wasn't me.
Yeah, it was.
Okay.
It's still something you did.
Okay,
What was?
that little prompt box, you hit that box.
Let's see.
Thanks to February.
Okay, that is passed on the vote of 20 yes. Thank you. Next resolution is 2020-38, approval of donation to the Aging and Disability Resource Center of Door County. We want to make a motion?
Supervisor Enoch, I'll make a motion to approve.
Thank you.
Nissa Nordum seconds.
Thank you, Nissa.
Again, this is a resolution to accept a anonymous donation, a very generous one. And the donation was made to the ADRC. It would go into, we have a general account that is set up for, it's what we consider non-designated donations. So in other words, the donation was made for the ADRC to be used for, I guess, what they feel is the best needs for those uses of funds. So again, right now, you'd accept that donation and that money would go into that account. In terms of, a question might be was, well, how do we do for future expenditures for that? We would work with, I guess, the home committee in terms of if they would like to allocate that, they would go through the committee process or through the budget process. So it'd be easier using those funds. But for right now, it would be just accepting those funds and that's where they'd be placed in the account.
Questions? If not, we'll go to the Vox vote. That has passed on a vote of 20 yes. Thank you. Next resolution is 2020-39, ratification of orders of the County Board Chairman and County Administrator per Resolution 2020-19. That's things that we had to accomplish under the emergency order without any committee meetings and prior to the board being meeting. So they're listed there. Go ahead, Ken.
Sure, so I can provide a summary. So if you look under the whereas, there's actually two items. Jason, are you going?
He's got it off.
Okay, Jason,
Okay, sorry about that.
our TS director actually comes that. Sorry. Anyways, sorry about that. So so there's two items, or actually two items, but two expenditures. But the one is the memorandum of agreement with the Deputy Sheriff's Association. And in essence, that agreement was established. We established new schedules for the Sheriff's Department in terms of rotating their schedules. In essence, what we're doing is we're trying to make sure that we're maintaining their safety. So we established, in essence, it's very similar to a 7-day working schedule where they're working 7 12s and then they're off 14 days. Then they come back. There's a little bit of a variation in there. That's a little bit because we also have on this, I guess, the second rotation, they're actually available for on-call for another 7 days. But again, what we're doing is we built up a schedule that would last approximately 3 months. Should it be necessary to allow the sheriff to work this schedule and keep the staff safe. In other words, if they got exposed, that way we have people in backup, but then also 14-day recovery period.
I would mention it was the sheriff who came up with the schedule. And then we had to get permission from the bargaining unit to make the change temporarily during this period of time.
That is correct. The next item is this expenditures that we have specifically related to the COVID. The first one is $900 is for face masks. And again, we made that expenditure just in terms of We did luckily get some donated, but initially we did not have any available for donation. So we do have, I guess, face masks available. They're not N95s, but they're face masks that are available should we start to open up, and we'll make those available for people in the building or for workers. Again, it's one of those things in terms of us planning, just in terms of the contingency. And then the next one is for the protective panels of $5,424. What we did is, in case, again, based off the timing, in terms of how we'd open up, we got protective panels. And what was really nice in this case, we actually worked with a local business, Hatco, actually provided all of those for the county. And that's an expenditure of $5,424. We do expect a few more next month, this in terms of for our library and library branches. But again, we worked with Hatco and they actually provided us a discount for that. So we're very thankful for Hatco for being a partner with us for that. So those were the, I guess, decisions or things David and I made decisions on that we need your ratification on.
Somebody care to make a motion?
Robillard, I'll make a motion to accept that.
Thank you.
Second.
Thank you. Any questions or discussion?
Yes, Mr. Chairman, this is Laura Wadachek here, Supervisor.
Go ahead.
Question and a comment. So since this is just a special tracking account, it doesn't need to get financial approval if this is the normal process, correct? And then because this is just a special tracking, it's not a reserve account.
That's correct.
Okay, and then also it's kind of going back to this with mentioning a company that's been generous in helping, and then also a large donation that came in, and the county board doesn't know who the donation, but what are we doing for showing thanks and gratitude to some of this collaboration and people really stepping up? These are new times that we're in, and I think as a county board, I would love to show us as a group showing thank you to them in some way or some form. Like Hatco, and then that large donation if we possibly could.
We typically, of course, send them letters thanking them, which comes from administration and or the county board if necessary.
Okay. Is that happening? Is that going to happen?
Yes, we do that regularly and routinely when something like this happens.
Okay, wonderful. Thank you.
Any other questions? We will move to the Vox vote.
Yeah, 20.
Okay, that is passed on a vote of 20 yes. Thank you. Next resolution 2020-40, authorize the Health and Human Services Board to act as Board of Health per 251.03 Wisconsin state statutes.
I'd like to make that motion. Please, Wadachek.
Thank you.
Second that, Supervisor Boltman.
Thank you.
So just for the entire board, I guess this is the last piece of the puzzle in terms of the work we've done over the past year and a half. Again, if you recall, we actually merged the Public Health Committee and the Human Services, both in terms of, I guess, physical organizational chart. In other words, Public Health became a division under Human Services. So that was that's what we considered phase one. And then phase two, we've been operating kind of as both committees meeting for the past 6 months, but now moving forward, this will be, I guess, combined as a single committee, and that's will be represented obviously in our appointments. But this is formally just adopting or updating it in terms of a resolution to follow the statutes.
Any questions? We'll go to the Vox Voter Board.
That was 20.
Thank you. That's passing a vote of 20 yes. Next resolution is 2020-41, appointments to committee, commissions, and boards, which was, of course, recently handed out to you. Hopefully, you've had a few moments to take a look at it. This was done as a result of myself as the chair putting together a draft. Some of these appointments are done via the county chair. Some of the appointments are done via the county administrator. So Ken also had his input into it. We then took our draft of this and had our meeting with our committee of committees this morning, which we had the recess. That committee met. And as a result, this is what we agreed upon for the appointments for me to put forward for approval.
Mr. Chairman, I'll make a motion to adopt resolution 2020-41.
Thank you.
I'll second that. Koho.
Thank you, Susan. Questions? Comments?
I have
Hi,
one
this is
question.
Erin Taufer.
Go ahead, Aaron.
Remotely, we don't have access to that. Is there a way that you could send a copy via email for Vinny and myself? And
Vinny, Aaron, and Nissa, you should have it in your inbox.
okay, thank you.
Thank you.
This one, Shag, we're just making sure. I guess, Vinny, do you have yours?
Mine. Yes, I'm just trying to split my screen and pull it up. Thank you.
Nissa, do you have yours? Okay. Aaron, we're just double checking which email account it went to. It went to both your accounts, both your district email and your personal email.
Supervisor Enigal here asking, could that be emailed to each of us?
Oh, so you have it electronically? Sure.
Yes.
Yeah.
We not immediately, but yes, we will.
Yes, definitely. No problem.
Just wanted to make sure. Thank you.
We're just waiting to make sure that Aaron gets hers. There's two sheets you're looking at. One is obviously the summary that has the committee placements. And then I guess where we're assigning the chairs. You will see that two of the committees do not have chairs because they're elected at the committee level. But then the second attachment is what we call the master list. And this is the master reference list that has every committee that actually defined out. And on those as well, what we have when you adopt this is we also have our citizen members that were reading or have been assigned to those committees as well.
I would also mention while you're taking a look at this, I would also mention that the intention is to start committee meetings again in the month of May. And during the month of May, when you have those committee meetings, we would like you to do the election of vice chairs for the committees that require the vice chairs. And as Ken mentioned, there are two committees that have to elect the chair in their first committee as well as vice chair. So that should all be accomplished in your meetings in May. If there's no other questions, we'll go to the. I'm sorry.
Make sure Aaron has.
Oh, I'm sorry. Just make sure Aaron has hers.
Aaron, did you get the file?
I have to refresh my Outlook. It's not updating, so one moment.
I'd also check your Gmail account because we also send it to that account.
I'm able to pull it up on my phone, so I have it. Thank you.
Okay. So we will move to the Vox vote on this.
We need for short one vote. Can you just make sure you have, oh, now we got 20 yes.
That has passed on a vote of 20 yes. Thank you. Announcements. The next county board meeting is scheduled for Tuesday, May 26th at 9 a.m. Again, remember to schedule your committee meetings through the chairs and do the election of chairs where needed and the vice chairs. The per diem code for today's meeting is 421. And I know that we also will be working diligently to figure out how we can do these committee meetings, either remotely or here at the building potentially. We're looking into a couple of things based on the change in, not the change, but the government being an essential business. We can potentially meet in larger groups than 10, although we still need to keep our social distancing. So we're trying to figure that out. So the committee meetings obviously are much smaller. We were thinking of potentially having them here in the boardroom, have all the committee meetings here where we could do the social distancing and still have the support of the staff. So we're working on that. We'll get that information out to you as soon as we come to it. If you have an idea, we would certainly welcome that also. Ken?
And again, I just want to take, and I apologize for,
I have a question. Are you going to go through schooling us on how to work this in our?
Yeah.
There's two updates. One's related just to COVID, and then one is just for follow-up for all the county board members. Just one update for under the COVID, and I think it's just important enough at least to give you a heads up. Obviously, the first, I guess, window of the governor's order, we tried to work with our employees as best as possible in terms of making sure that they were either covered or provided the best opportunities to maintain their wages given this situation. Now with the governor's order extended, I guess our goal is still to be a very good employer, but I guess we're also trying to look at what's reasonable for us in terms of our operations. Also realizing the fact that we are probably going to be facing some deficit on this budget just in terms of our sales tax and other revenues. So I'm also trying to protect us as a county. So what we are doing organization-wide is we're going through position by position, and we're actually classifying them as pretty much status quo. In other words, they can work here or at home and still perform their duties of their job. The second class would be a furlough. And by furlough, what that means is that we would potentially either reduce their hours or they would have no hours between starting next Monday through the 24th of May. But the benefit of the furlough is that they still maintain their employee benefits during that period of time. And then the third option would be a potential layoff. So those are the categories we're looking at across the board for our positions. I guess I felt that it was important enough to inform you of that as an organization, we need to look at that, and that we'll be implementing that this week in terms of our operations. And that will come just with the timing of our county board meeting, the things we're doing, we'll be implementing that, but then it'll actually come back after we're hopefully back up and running again with all those people returning back to work at regular status should the governor's order expire. But I just wanted to give that to the county board so that way they start to hear that. That's what we're doing in terms of our organization. We're trying to be as consistent as possible to all positions and as fair as possible. But again, going through position by position to determine what's the best method for moving forward.
Ken, on a furlough, is the employee able to go on unemployment?
So that is the part of the benefit of a furlough is that one, they still maintain their benefits. In other words, they maintain their insurance and they actually still own their vacation time. But for their reduction of hours, yes, they can apply for unemployment insurance.
Thank you.
The other item was just to report, obviously, we're not doing the orientation. I guess my thing is for the members that are, I guess, continuing on. If you have questions on the orientation, I'm more than willing to meet with you one-on-one. For the new members, I will probably reach out just to kind of go through that information with you to see if you have any questions. Either way, I will also reach out probably to every single supervisor just to kind of go through. We have a new expense voucher thing that we'll have you fill out. So we will, over the next 2 weeks, I'll go through that with you before we start all of our other committee meetings. So I'll make sure that you understand how we're going to submit vouchers in the future using the new system. So just relax right now, take a breath, but I'll follow up with you individually. We'll show you how to do it.
Okay, thank you, Ken.
Comment?
Go ahead.
Well,
Yes,
Yeah, all of you who get WisPolitics emails and are getting NACO, that's the National Counties Organization, and the Wisconsin Counties Organization emails, you probably know that the bill that is coming up in Congress soon, not this one most recent, but there's supposed to be a bill proposed with funding for local and state governments. They have not been taken care of in the way that individuals and small businesses have. And NACO and WCA have asked us several times to lobby on behalf of them, please, taking care of local and state governments in their funding bills. So as you see those, wouldn't hurt to reach out to our national legislators.
okay, thank you.
If they didn't get the WCA packet, I will be at the door with anybody who didn't get the
Okay.
WCA.
And Jill is letting us know that anybody who did not receive a WCA packet, that she will be at the door down here as you exit, and she will have them available for you. Right, Ken?
And I guess the only last thing just to mention, again, I apologize for some of the hiccups we started with, but I would like to recognize both Ashley and Jason and his team. I know we had some technology issues. A lot of it's outside of our networks with WebEx, with people across the country using the technology. So I appreciate your patience with us today, but I do appreciate the amount of work that TS did to make this work, both the voting tools and all the other stuff. I know it seemed bumpy today, but there was a tremendous amount of work behind that, and that would not have happened without their support. So I just wanted to pass that on, and thank you for your patience today.
And I also want to thank Ken and Jill and Lori for all their work and input on getting and pulling this off. And we will continue to learn, and we will continue to get smoother as we go. And I hope everybody is able to get back to committee meetings and get back to a little semblance of some order back in our government. Thank you, everyone.
Mr. Chairman,
Thank you.
Mr. Chairman?
hey, it has been, if I may, a tradition for me as the vice chair to make the motion to adjourn. I'd be happy to pass that tradition off to the new vice chair, Susan Cohout.
Mr. Chairman, can we hear the report from Emergency Management and Sue Powers, please?
Sure. Yeah.
Sure. Thought we were done.
We're going to provide their report to us from the COVID-19 matters under consideration, number 814 of the agenda.
Okay, I didn't. Ken, what?
Sue and Dan were available to give an update. I forgot to get them.
Okay. All right, I'm sorry. Sue or Dan, would you like to give an update?
Sure, this is Sue. I will start. I'm just moving over closer to the microphone. So I'll begin with the numbers, but I think as I did last month, preface that with talking about numbers, the explanation that numbers may not reflect the true number of cases. Statistically, it's likely that they reflect a fraction of the true cases. And one of the things about our numbers is at present, through our investigations, there's no evidence of community spread, which is fantastic. Confirmed cases of COVID-19 in Door County residents remains at 9. And of those, per our follow-up in investigation, 6 have recovered. So they're out of isolation. There's been 1 death. Negative tests. So far, there's been 190. That was of this morning. I bet you in the last couple of hours, there's more. 20 tests pending. Other good news is the turnaround time for testing is down to 4 days. So it's about half as what it was to begin with. And we do put that information on our updates Monday through Friday. And we try to follow the state guidelines on how to report numbers. So, of course, as you're aware, we're significantly less in numbers than our neighbor Brown County. And I can't say exactly why, but I can tell you what things are going right for us. Currently, public health is still functioning under the incident command system, which means other programs have been put to the side, except for WIC, because that's pretty essential right now for folks. We've always done communicable disease investigation and follow-up, so this isn't anything new for us, except that COVID is brand new. We continue active surveillance, and what this exactly means is that we follow up with everyone who's been tested. And now I can't say that we've gotten a hold of all those tested, but we make 3 attempts to contact everyone to reinforce the guidelines they've been given at the testing site for isolation, and to have a conversation about what that means and what kind of support they might need, that we could refer them to community agencies. With confirmed cases, we do a full contact investigation, which means tracing of anybody they've been in contact with during the infectious period. And we've had great cooperation with those who've been diagnosed. There's been no problems with them isolating themselves. Our next priority is working with our vulnerable populations, reaching out to the long-term care facilities and keeping a conversation going with them about what challenges they're having. And our third priority then is messaging. So along with the incident command systems, some of our public health staff is functioning outside their usual role. And of course, we've adopted Dan Kane. We hope he'll stay forever. It's a great partnership. We've also had some staff from other units of Health and Human Services helping us, which has been great. So we're able to keep up with our current situation and our workload, although we have changed to operating 7 days a week out of necessity, but we only do the essentials on weekends, which is why we're not reporting the numbers on weekends. We don't have clerical staff coming in. We just have myself or the nurses alternating follow-ups. So we're certainly stretched, but we're doing fine. Other things that are going right, there's no shortage of tests or testing capabilities at this time in Door County. I just want to really be clear about that. Door County Medical Center has been very proactive in their response to COVID. And if you're not aware, please understand they've increased their capacity for inpatient rooms as well as testing. They have also begun some in-house testing, which results are available within an hour. And they do have certain criteria for who gets those tests. So we have a strong collaborative partnership with Door County Medical Center, as well as other community partners. And, you know, I can't emphasize that enough. One thing that's really going right for our community is that historically, it's been a very collaborative community, and this continues. Despite that this situation has potential to challenge those local relationships between agencies. And one of the really great tools has been the County Emergency Operations Center. And I won't go into that. I know Dan's going to talk about that. So we're coming into a challenging time, I think, because of the Badger bounce back. I love the message of hope. Everybody's frustrated with the situation, but coronavirus is here on its own timeline. Safer at Home is working, and really the only tool we have to slow this down is to limit physical contact. There's no treatment, no vaccine. Public health is working as other agencies are to protect the health and safety of everyone here and reduce the risk of a sudden increase in cases. So I'm really bearing in mind the unique nature of our community, as I'm sure you are, with the tourist season coming up and our percentage of older population that are more vulnerable to COVID. We're going to have some tough decisions coming up as to how to proceed forward. And while I've issued some health orders and that sort of thing, I'm certainly not functioning in a vacuum, throwing out ideas in the EOC and with our county administration so that we can safely return to work and other activities without increasing the risk of more COVID. And that is all my update. I'll turn it over to Dan.
Over the question.
Sure.
Of the 9 confirmed cases, how many, if you can have an answer to this question, how many were at any time spent in ICU?
I can't answer that question. I don't know.
I figured, I kind of expected that. Thank you.
Okay. Good afternoon, everyone. Dan Kane, Emergency Management Director. I'll try to keep it brief. It's been a long morning. Sue, just want to thank you for the kind words. Appreciate that very much. A couple of things I just want to touch on in regards to this. The first thing is, I believe, as I'm all the research I've been seeing, all the stuff I've been seeing, as a society, I do believe that nationally, we are starting to see the formation of 2 different groups in response to this pandemic. One group is under the impression that everything is going well. The mitigation strategy and efforts to curb the spread are working. They encourage laws and regulations to continue to support that initiative. I think there's another group that feels that we are overreacting, things are overblown, and they want to condemn any sort of further action or extensions going further. I think the bottom line of all this is that, and it's the downfall of mitigation, is that mitigation is not always viewed positively due to the difficulty in accurately showing its effects. We see this a lot in emergency management outside of this spectrum, but mitigation isn't always an easy sell, because if everything goes right, then nothing happens, right? So it's a tough sell. So if we could accurately show the benefit, I know there's the Wisconsin DHS, Department of Health Services, has put out some charts and things kind of mapping out what it could have been with nothing else in place. But to accurately show that, I think would go a long way to providing people some motivation to stay the course. I know that government at all levels is still learning as we go with this, and we're writing the script in real time. The last time we had something like this was in 1918, and they didn't take good notes on how to handle this. So we're learning, and so decisions are being made, and in the best interest of everybody, hopefully. And I don't envy those. To Sue's point, I don't envy those who are needing to make these decisions, as there sometimes is no correct answer, no matter which way you slice it. That will not either create blowback or pressure. So again, there are no easy answers to it, and I can just support what Sue has said in terms of the actions taken locally. They're not made in a vacuum, and just having been in the room when these discussions are taking place with the decision makers, they are thought through thoroughly in what makes the most sense for the health and safety of the community, while also trying to maintain a level of normalcy. The next thing I want to talk about quickly is briefly on the testing and the security. I would encourage us all as we go through this to be aware that even though we have only had 9 positive tests, this by no means accounts for an accurate number of people who've been affected by this locally. And it's very important to note. There's a lot of asymptomatic people out there that don't show signs that could have it and potentially spread it. So again, 9 is just the number that we've actually tested that showed up positive. So don't rely on this number necessarily to give you this false sense of security. Treat this issue as if you have it and your neighbor has it. I think that's the best recommendation I've heard to this point, until we can get a vaccine. I say this because, we don't want people to just think that our positive counts have not gone up lately. So therefore we're getting out of the woods, if you will. We're not there yet. Statewide case counts are still increasing. And as we do more testing, that might level out. But as far as now, they're still increasing in numbers as of yesterday. And I know this governor's extension is inconvenient. By no means is it convenient for really anybody. Real goal is to prevent more people from getting sick, and it buys more time ultimately for healthcare and the healthcare world to be able to be staffed and properly protected with PPE to fight this thing. Because PPE is still a major issue. Personal protective equipment, acquiring that is a huge issue right now. So we need to have that in place before, otherwise we're just going to be limping along. when these restrictions do loosen, I think it's going to be important, and we're going to be planning for this to prepare for the possibility of a second wave. Some of you may have heard about the fall might bring in second wave or tourism. We need to be aware of that going forward. I think Sue may have mentioned that in her brief. Tourism is a big issue that we need to contend with up here, and that has a potential to bring additional cases to our county. Currently, our operations, I'll touch briefly on our current operations. Sue touched on it a little bit. We are working emergency management early on in this. We're on week 6 of the response, if you can believe it. We have worked closely with public health to get their incident command system established and provide any sort of resource support when needed. We did activate the EOC several weeks ago. This group, the Emergency Operations Center, the EOC, meets daily. We go over and discuss objectives for the day and provide situational awareness to all of our stakeholders and partners in response. Really, the goal of this group is to prevent siloing in our response, and it allows for much more coordinated effort and information sharing to happen. Early on, our priorities were around information sharing, public information. You couldn't get information out fast enough. So that was really our focus early on from the emergency management standpoint in the support. We helped curb that with a situation report that Sue mentioned that goes out 3 times per week, Monday, Wednesday, and Friday. I would highly encourage anybody that is not, you should all be getting the email directly from us. It is also on the website that I just learned today is now seeing somewhere in the neighborhood of 25,000 hits per week on the COVID site. So highly effective there. Great to see people are utilizing that information. There's a ton of it on there. So I would point people that have questions to that site. It's got a lot of information on there. Check it out if you haven't already. It has frequently asked questions and answers to those things, amongst other types of resources. So highly recommend you check that out if you have not. We also have established a weekly all-call that allows municipalities and other external stakeholders to have a chance to ask questions, and we can assess their needs. So we're just keeping that open line of communication to the local level to make sure that we're not missing anything locally. Again, our focus has gone initially from information sharing and public information to now that sort of winding down, and our focus is shifting more towards PPE inventory acquisition and allocation and long-term recovery. So in order to address that, we've had a logistics task force and a long-term recovery task force created in the EOC to help address these issues and figure out how we're going to move forward. Badger Bounce Back is going to be a big player in that, as that just got rolled out. For those that haven't read it, it adopts a federal plan that was put out on 4/16, and it supersedes any local order done. There are special exemptions for localized outbreaks that can be made in consultation with the state, but ultimately we have to follow that playbook. It's going to roll out in 3 phases. After 5/26, so after the stay-at-home order does lift, it would be 3 phases, but it does not lay out a physical timeline. Very important to note there. People want to know when are we going to get back to normal. The virus gets a vote on this one, and when we're able to move forward. So really, if you read through it, it talks about we need to increase our testing and tracing. And as a state, we need to see a downward decline in these numbers for 14 days in order to go to the next phase. So again, just important to note that there is no necessarily date stamp on any of this. And that's about all I have. We're going to be basically in this group of phases until we get a vaccine, and that's really going to be the next time we get back to our old way of living, if we ever do get back to that point, the closest thing we can get. So with that, thank you guys for all you guys do, and if you have any questions, I'll be happy to take them.
Any questions of Dan or Sue?
I have one, Vinnie Shomo.
Go ahead, Vinnie.
Thank you so much for all that you're doing and for your reports. It's been a really amazing response and services for our community. This might not be a question that you can answer right now, but I'm wondering about, as the phases begin after May 26th, phase 1, what do you see as a good place to direct local businesses for any PPE equipment they may need to be able to open? Or I've read through a lot of the CDC and the Badger Bounce Back. I think a lot of local businesses are trying to figure out their best course of action as to not only if they can open, but how. So what's a good resource for them to go to?
A couple of things on that. The first thing is this long-term recovery task force group in the EOC is looking to figure out how we can figure that issue out as part of what we're doing. The answer I can give you now is that from the state, they're asking businesses to follow their standard business practices for procuring that PPE. It's not a good answer, but there is just no PPE in general out there, even for public safety. The state is asking emergency management to take the lead on PPE locally. And so we, through our logistics branch, are looking to identify all of our frontline personnel and be able to see what we can get them. And even that supply is short. So let me just be clear about that. We don't have enough PPE to supply to our first responders necessarily for the long term. We're okay right now, but at the longer this goes, it's difficult. So again, we're trying to find every nook and cranny and turn over every seat cushion to find what we can. But the guidance from the state right now is that everybody tries to procure through the normal channels locally. And so right now, that's about the only guidance we have.
Thank you.
Other questions, Supervisor Watercheck?
Go ahead, Laura.
Yeah. Thank you, Mr. Chairman. As elected officials and everything that I'm seeing and hearing, I'm still sensing a lot of fear in people of the unknown resources, and very similar to what Dan just said about looking for PPE and masking. I know that you have made done some interviews early on in this, and I was just wondering if you, as our chairman, is looking to do another interview, possibly teaming up with Dan, just to give that reassurance out to the public and setting that tone of hope and reinforcing about the direction that we're going and maybe the needs for the PPE. Would you be doing that?
Again, this is Ken. I know one thing that came up this week is trying to maybe look at that. There was some discussion, like for example, I know the Sue and the doctor, they do a Facebook Live on Mondays, and they've done that. There's been some discussion of maybe doing something similar where I didn't list David or myself, and we do something similar. Now, is this a discussion this week? But that's something that we're looking at. I think the group was going to discuss it early next week.
Right. And I can tell you, most of you probably know, we've had really good media response to anything that we have put out. Between Ken and myself, we have done numerous interviews, TV, radio, print, and they call back continually to get updates, especially when Sue or Dan put something together to do that. And we've been using the media, if you will, to help us go the right direction. And that's why we were thinking about doing something that, just like Ken just mentioned, to continue that.
Great. I think with everything that's happened in the last week, that would be wonderful to do that again, to reinforce what we're doing and how we're doing it. I think there's a lot of people looking for leaderships on this and reinforcing those messages. So thank you.
Anybody else? If not, I want to thank Sue and Dan also. They have worked very, very hard the last 6 weeks. This has been a 6-week slow and treacherous marathon for them. And they certainly deserve to be applauded. They still have a long ways to go, of course. But I know in all the meetings that I've had with them and all the video conferences with them, they are doing a lot more in the background than any of us are aware of. And a special thanks go out to them and their team. So thank you, guys.
Thank you. Thank you.
Conflict of interest.
For supervisors that either didn't get the conflict of interest, it was in your packet, but if you haven't printed it out, I need the conflict of interest statement return. There's a yellow on the front and the conflict of interest is on the back, along with the supervisor information sheet, so that we can get that used for publication of the directory, please.
I will turn it back over to Mr. Fisher. He was speaking to Supervisor Kohut.
Thank you, Mr. Chairman. Are you there?
I am there. And Mr. Fisher, that is a very nice offer. but because you do such a wonderful job with it, if you would be willing to continue, I would love it.
Thank you for that. That being said, Mr. Chairman, if there's no further business to be transacted, I'd like to make a motion, we adjourn.
Is there a second?
Second.
Okay. All right. All in favor?
Aye.
Aye. Thank you, everyone.
Aye.